of the heart, this is the right. Got that? The right ventricle left, and your PVC was coming from here. We mapped on this side, the right side and the left side was coming just in between. We thought it was gonna come from that area as well. So we went across to the right atrium and ablated from the left side right here. So we got some reasonable good results here, but it wouldn't suppress it completely because the PVC is actually coming from this vein here because it's inside the septum area, so inside this thick muscle. I'll show here in the camera. And the only way to get there is when you go outside the surface of the heart through this vein. So the blue structure is the vein because the vein runs in the outside structure and has tiny branches that go inside that septum here. So you see here? So that's how it's constructed. But the problem with this vein is that the catheter doesn't reach down there because it's too big.
Right.
So we try to go as far as we could, but we don't have technology to ablate with an ablation catheter deep inside. So what we're gonna do, we're gonna see what effect it will have. I expect that some of these areas that we ablated up to here in the venous side, the blue thing, in the outer surface, ablated here. So expect that your PVCs with the scarring may still get better. But what if they don't? So we have two choices. One is to give you medications. There's a medication called flecainide that can try to give you that. Second one, what we can do is an ablation using alcohol. So we inject alcohol inside this vein here. So we put a balloon here, and we put a balloon here, and we inject the alcohol, right? We put a tiny catheter because then we can use tiny catheters, and the alcohol kind of ablates the tissue because it's not regular alcohol. It's alcohol very concentrated. Usually requires a couple of ml or cc's, and we occlude the vein, inject, and the alcohol sits here for a couple minutes, and then it ablates down this muscle. It's in the middle. So this will be the next plan in case you're bothered by the PVCs or decide for medical therapy. So let's see how we do. We're gonna have to decide this in the next couple months. First, we'll wait a couple months to see what is gonna happen to the PVCs, because if they're still there, they may be suppressed somewhat. If they're suppressed, maybe you're going from having 12, 15,000 a day to have a couple thousand and not even be bothered by it. If they're not, then you have to be decide about medical therapy with drugs or trying to do this. Okay?
Okay.
So that's the plan.
All right.
All right?